Thank you for joining us for the Washtenaw County Health Department's COVID-19 Quarantine and Isolation webinar for parents and guardians. The purpose of this webinar is to help you understand why your child has been asked to quarantine or isolate, as well as to provide some guidance on how to keep them and your household members safe over the next 2 weeks. In this presentation, we will define quarantine and isolation, discuss why your child has to quarantine or isolate, and define close contacts. We will also describe how to safely quarantine or isolate your child at home and share ways in which you can keep your household members safe. We will also discuss symptoms to watch for, address whether and when your child should get tested, and provide instructions on what to do if your child gets sick or tests positive. So let's begin. What is quarantine? Why is your child required to quarantine? Quarantine is when a person who was a close contact of someone who is sick or has tested positive for COVID-19 stays home and watches for symptoms to see if they start to become sick. A 14-day quarantine period is recommended. This is because it could take up to 14 days after an exposure to COVID-19 for symptoms to start. A person may end quarantine after 10 days as long as they do not show symptoms in the first 10 days after their exposure. They must also continue to watch for symptoms for the full 14 days after exposure. To be clear, there is still a risk of developing an illness between days 11 and 14. It is simply lower than the first 10 days. Quarantining for a full 14 days is the safest for everyone. Here's an example of a possible quarantine timeline. On December 5th, Jasmine had close contact with her friend Sandy. Sandy was feeling sick that day and later tested positive for COVID-19. Jasmine's quarantine begins the day her parents find out about her exposure to COVID-19. If she has not shown symptoms for the first 10 days after her exposure, her last day of quarantine may be on December 15th. However, there is still a chance of getting sick between days 11 and 14, and this may increase her chances of spreading COVID-19 to others if she did get sick later. For this reason, it is recommended that she quarantine for a full 14 days until December 19th. You may have also heard the word isolation. Isolation is when a person that is sick stays home and away from others to prevent the spread of illness. A person with COVID-19 should isolate for a minimum of 10 days after starting to feel sick or for 10 days after a positive test if they have no symptoms. Isolation should only end when a person's symptoms are improving and when they have gone 24 hours without vomiting, diarrhea, or a fever, without taking medicine to stop a fever. Here is an example of a possible isolation timeline. On December 5th, Ava begins to feel sick and her parents keep her home from school. She gets tested for COVID-19 that same day, and 2 days later, she receives a positive test result. If by December 15th or day 10, her symptoms have improved and she has gone at least 24 hours without vomiting, diarrhea, or fever, she may end her isolation on December 16th or day 11. So what is the difference between quarantine and isolation? Quarantine is for people who are not yet sick but have been exposed to COVID-19. Isolation is for people who are sick. They have signs or symptoms of COVID-19 or have tested positive. Isolation guidelines will be discussed later in this presentation. So what is a close contact? Does your child meet the definition of a close contact? Your child has been identified as a close contact of someone with COVID-19. They have had at least 15 minutes of contact within 6 feet of someone who has COVID-19. The 15 minutes may not have been all at once, but can be 15 minutes total over a 24-hour period. Someone is also a close contact if they had physical contact with someone with COVID-19, even if it wasn't for 15 minutes. This could have occurred through hugging or kissing, by coming into contact with a sick person's coughs or sneezes, or contact during a high-impact sport. They may also have shared eating utensils with the sick person. Your child may have had direct contact with the sick person, with or without a mask or protective barrier, during the time the person was sick or contagious. They may also have come into contact with this person's saliva or breath. During quarantine, it's important to keep other household members as safe as possible. This means that your child who's quarantining must stay at home and away from others. Just in case your child is infected and is not showing symptoms, it is important to follow these steps to keep other household members safe. Watch your child for the full 14 days after their exposure to see if they develop symptoms. While at home, your child should stay in a specific room and away from other people in your home as much as possible. If they are in a room at the same time as someone else, they should be wearing a mask and should try to stay 6 feet apart. They should not be sitting next to household members or sharing toys, eating utensils, or cups and bottles. If possible, your child should sleep in a separate bedroom away from others. They should also use a separate bathroom, and everyone else should not use that bathroom while they are quarantined. If they do need to use the same spaces as others, such as the bathroom or kitchen, you or your child should be cleaning surfaces after they touch them. For very young children, we recognize it is not possible nor developmentally appropriate to be separate from them. In this case, you may want to identify one family member or household member to be the main caregiver for the sick child. Together, you can isolate as much as possible from others. This way, you may care for the sick child while also protecting the rest of the family. Following these precautions will reduce the chances of spreading the virus to other members of your household if your child were to be infected but not showing symptoms. To be safe, make sure your child stays home for the remainder of their quarantine period. Household members, such as siblings who were not exposed, can still go to school or work unless the person in quarantine becomes sick. Your daycare or school exclusion policy may require your child to be out of daycare or school longer than the county quarantine or isolation period. Washtenaw County's minimum isolation period is 10 days. However, due to licensing requirements, your child's school or daycare may require them to be out for a minimum of 14 days after their exposure. This is allowable and is up to the discretion of the school. Please follow the school or child care provider's guidance on when they may return. You're probably aware of some of the symptoms of COVID-19, but as we learn more about the virus, we're learning about additional symptoms. So let's briefly review the list of symptoms you should monitor for. Symptoms could include cough, shortness of breath or difficulty breathing, loss of smell or taste, fever, chills, body or muscle aches, headache, sore throat, nausea or vomiting, diarrhea, fatigue, congestion, or runny nose. If your child is not feeling well, this chart may help to distinguish whether their symptoms are due to a cold, the flu, allergies, or COVID-19. It is important to note that symptoms can be different from person to person, and some people may have mild symptoms or no symptoms at all. If your child begins to get sick, it is very important that you isolate them at home and away from other household members. If your child gets sick or if current symptoms worsen, call your child's doctor to receive further guidance, as well as the Washtenaw County Health Department. You should continue to keep your child at home and begin to isolate them from others as much as possible. Follow the Washtenaw County Health Department's guidelines for isolation. Other household members should now practice quarantine measures, so they should stop going to work or school and start tracking their symptoms on a calendar. Since your child is a close contact of a person with COVID-19, they can get tested even if they do not have symptoms. Testing is recommended, but not required. If you do decide to get your child tested, ask their doctor or testing site for a non-rapid nasal or saliva, molecular, or PCR test for the most reliable results. Since it can take time for the virus to show up on a test, the best time to be tested is between 7 and 10 days after exposure to COVID-19. If your child begins to show symptoms at any time during quarantine, they should get tested. Your child cannot test out of quarantine. If your child tested negative, that means they were probably not infected on the day they were tested. However, that does not mean that they will not get sick in the future. It is possible that they were very early in their infection when they were tested, and they could show symptoms or test positive later. If your child was tested and is still waiting on test results, it is important they remain home and in quarantine until you get their results. Please contact the Washtenaw County Health Department when you receive your child's test results. If your child tests positive for COVID-19, please follow these guidelines to keep them and your household members as safe as possible. To keep other household members safe, parents or guardians should wipe down all frequently touched surfaces, keep track of symptoms daily on a piece of paper or calendar, and parents should also have all close contacts and household members stay home from work or school and quarantine for 10 to 14 days from the last date of exposure. Household members should also begin to keep track of any new or worsening symptoms. If your child tested positive, please isolate them and follow our guidance for keeping your child and household members safe. A health department case investigator may reach out to you to do a more thorough case investigation. However, they may not reach out to you right away. In the meantime, please continue to isolate your child at home until you are contacted by the health department. For more information on COVID-19, quarantine, and isolation, please visit washtenaw.org/COVID-19. Thank you for watching.